Met Margaret on the southeast side of Cleveland, Ohio, which pretty much borders the beginning of the suburbs. I was 11 years old at that particular time. Margaret would have been 13. God put me to work in 2002, about 3 months after my job in the steel industry came to an end. And in 2006, trusting in God, we gave up everything in our life. We were enrolled in Pacific Lutheran Theological Seminary in Berkeley, California.
Oh boy, here comes the sign. My name is Margaret Monroe, and I'm a second-year student at Pacific Lutheran Theological Seminary.
Her first weekend on call, she preached for the hospital community and was on her way back to the supervisor's office. She had a massive coronary, and she died. And truly, my whole life stopped at that moment. I've never experienced anything as far as the depth of pain and grief that overwhelmed me. And it's not because of nostalgia or wistful memory type things. It is the truth. She was the very best part of me.
More women die of heart disease than men in the States every year since 1983. So it's a huge problem among women. 5 times as many women die of heart attack as breast cancer. Yet very few women have any knowledge of that or any inkling of concern about heart disease compared to breast cancer. So when we talk about the mammogram of the heart, that's at least 5 times more important to women than the mammogram of the breast.
With heart deaths stubbornly high and stent overuse discredited, you'd think the mammogram of the heart would be on its way back, but you'd be wrong.
So we are going to put a stent there now. Okay, give me a 2.25.
There's one last key opponent, the insurance industry. They won't pay for the test. Ironically, the headquarters of giant health insurer Kaiser Permanente are just across the bay from the offices where the very first scanners are installed. In the early 1980s, the Kaiser board come calling.
We met with the Kaiser executives. Of course, most of them came in to be scanned. And some of the Kaiser researchers did some excellent research on coronary calcium screening, published research.
But that didn't mean they'd pay out for their policyholders to have one.
They said, we're not interested because our typical patients are only in the plan for 5 years or less. And this is a long-term cost savings. So the cost savings will go to our competitor. And no need to single out one particular health maintenance organization. All the insurance companies told us basically the same story, that their patients are not long-term holders of that plan. So if they reduce cost over the long term, it means nothing to them. It only goes to their competitor.
We contact the big insurance companies, Kaiser and the rest, to find out why they will still pay for a $50,000 stent, but not unless you're very lucky, a $100 test. But they won't talk. Then one man is brave enough to break the wall of silence. He's been the public face of 2 of the big 5 as their media spokesman.
I was a journalist, a newspaper reporter for some time, but then I got into public relations work, and I realized toward the end of my career that something had happened to what I was doing for a living, and it just dawned on me that in many cases I was doing the exact opposite of what I was trained to do as a journalist, which was to try to find truth and as best I could report it to do that. It sounds kind of trite, but I did look in the mirror and say, what happened to you? How did this happen to you? The system is not set up to reward prevention. The system is set up so that doctors are well compensated for treating conditions. So are pharmaceutical companies. We mainly have a disease industry in this country.
We've got a healthcare system that's out of control, spending an incredible amount of our national wealth, not making people better. We've developed a system that's based upon putting out the fires, taking people with chronic diseases and doing all these things to them.
There is just not nearly enough attention paid to trying to help keep people from getting sick, from getting congestive heart failure, from getting the kinds of illnesses that require stents and being put on maintenance drugs and having expensive care for the rest of their lives. They don't want them to die, but they don't necessarily want them to get better.
Well, that's where the money is. It's like the Willie Sutton law.
It's Sutton's law. When asked Willie Sutton, why do we rob banks? He said, that's where the money is. So the insurance companies are following Sutton's law.
You don't get to be CEO of a company because you've saved lives.
Despite the fact that most insurers still won't pay for it, more and more people are going for a scan. After sewing up a big business deal in the US, Irish entrepreneur David Bobbitt went to have a medical checkup. Part of it, a coronary artery scan. He had the shock of his life.
My arteries were that of an 86-year-old. So here is a 51-year-old who exercises every day, is careful what they eat. My parents lived into the 80s. I'd done all of the things you were supposed to do to be healthy. The following day I had to go in to do an angiogram where they found I had one totally blocked artery, I had another artery that was 70% blocked, and I had a huge level of disease right throughout my system. And the clear suggestion was I was either going to have stents put in or a bypass. The shock of it, the shock of suddenly going from one day feeling absolutely perfect with no reasons of any issue at all to a situation that 75 out of 100 people at your level of calcification is going to either be dead or have a heart attack in the next 10 years. My daughters, that are just so special that I would be there when they got married or when they were that bit older, that I'd see my grandchildren. That gave me hope. That really was what really was so important, why I wanted to fight this as hard as I did. And I would fight because it was important to me.
Without the shock of that first scan, David might not have changed his life around, might not have been here today for his family. But now the hope he has can be shared by millions. For all the problems of the way medicine is run in this country, the ultimate obstacle in the scan's path is that it lacks official approval. Then, in October 2012, after all the years of opposition, the American Heart Association finally relent and issue a statement saying that coronary artery scanning is beneficial.
Breathe in. Hold your breath.
Yes, I feel vindicated. I'm just happy that we were working on something that turned out to be valuable.
Well, I mean, so, there's this old saying that truth passes through 3 stages. First, it is ridiculed, then it is violently opposed, finally it is accepted as being self-evident. So I think we went through the ridicule stage. I think Bruce took most of the heat, and then we got the violent opposition stage with some people who've now been proved incorrect and now have retreated, and now I think we're finally being accepted as being self-evident.
The data really does speak for itself. And when the American College of Cardiology and the American Heart Association signs off on it and says it's reasonable to use it, then the remaining naysayers are just a voice wandering in the wilderness.
We could have gotten there, in a perfect world, we could have gotten there in 3 to 5 years. We'd all gotten behind it in the beginning.
Well, and so what?
Well, how many lives do you think would have been saved if we'd done it in 1990, what we're doing now in 2013?
And the answer is?
Heart attacks and strokes are absolutely preventable. The science is slam dunk.
every time I read the newspaper and I see, you know, a 45-year-old or a 55-year-old or a 62-year-old person just drop dead of a heart attack unsuspectingly, you know, it's a little disheartening because I know that that life would have easily been saved.
Look, what are your alternatives? You say to a person, well, you're at low risk, and then if the patient dies, oh, I was wrong, sorry. Why guess? Why base your decision on a score derived from a compilation of risk factors when you can look directly at the heart and see how much plaque there is there? I would say that there are some people who still believe the world is flat, but clearly it's not. We know that it identifies high-risk patients. We know that treating high-risk patients saves lives. Therefore, identification of the high-risk patient will save lives.
911, my husband's having a heart attack. We're going to start CPR on him, okay? I'm going to tell you what to do. Okay. Are you right next to him? Yeah. Okay, put him flat on the floor on his back. Okay. Expose his chest. Expose his chest. Kneel by his side. Okay. 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 Put the heel of your hand in the center of his chest, right between the nipples. Okay. Push down firmly with only the heels of your hands, 2 inches. Okay. And do it 30 times like you're pumping the chest. I'm going to count. I want you to go this fast. As fast as I'm counting. 1, 2, 3, 4, 5, 6, 7, 8, 9.
The COVID-19 pandemic that killed more than 1 million Americans has come to an end, and I sincerely hope that your life is getting back to normal. It's time to relaunch the Save Your Heart campaign. This campaign is not just about spreading awareness. It's about taking action and making a tangible difference in the fight against heart disease. I can't write to everyone that I need to, so I am publishing an open letter to various stakeholders. Through this letter, I hope to highlight the importance of calcium scoring in saving more lives and addressing the pressing issue of undiagnosed coronary plaques in our society. To all the primary care physicians out there, I ask you to recognize the life-saving potential of calcium scoring in your older adult patients. This simple test can easily save more patient lives by detecting asymptomatic, undiagnosed coronary plaque buildup, allowing for timely intervention and optimal medical treatment. Next, a message to insurance executives. It's time to stop keeping your older adult policyholders with undiagnosed coronary plaques in a virtual holding camp. This lack of diagnosis and treatment is causing premature deaths and chronic cardiac illnesses, and we can no longer stand idly by. Let's prioritize the health and well-being of policyholders by ensuring coverage for calcium scoring without any added cost. Employers also play a significant role in the heart health of their employees. I urge you to step up and protect their cardiac health by demanding coverage for calcium scoring as part of their healthcare benefits. Prevention is key, and by detecting coronary plaques early on, we can save lives and reduce the burden of heart disease on both individuals and businesses. To our policymakers, I call for a thorough investigation into the harm caused by denying coverage for calcium scoring since 2012, despite its official recommendation by the American Heart Association and American College of Cardiology. We need to understand the reasons behind this denial and, if necessary, pass a law mandating coverage to ensure equitable access to a life-saving test and remedy the wide disparity of care starting with Medicare. If older Americans with silent plaques are identified earlier and receive optimal medical therapy for at least 5 years before they become Medicare beneficiaries, it will drastically reduce Medicare expenditures on cardiovascular diseases. The same medical treatment that prevents heart attack also prevents stroke. AARP seniors, with 20 million members aged 50 and older, you hold significant power in creating change. Many of your members may be unknowingly trapped in a virtual holding camp with undiagnosed coronary plaques. Let's mobilize and educate each other about calcium scoring, empowering every individual to take charge of their heart health. To the healthcare entrepreneurs, listen closely. We need fresh ideas and a new updated cardiovascular healthcare model. Think out of the box. The Good RX is a good example of a disruptor in the drug benefit business. The cardiovascular sector of the healthcare industry is ripe for innovative disruption. Heart attacks are largely preventable. People are dying needlessly, and those that survive develop chronic cardiovascular illnesses that drive healthcare costs up. Let's join forces and bring about positive change in the fight against this deadly but largely preventable condition. Let me continue this companion video to this letter. Let me spend a few minutes to explain why people have a heart attack. Why a heart attack is often the first manifestation of a heart problem, and people die without knowing what really happened. They are dead before they know it. Why it remains the #1 killer of adult Americans even when heart attack is considered largely preventable, even among those with significant coronary plaques already. Let me tell you what is coronary plaque buildup, also called coronary atherosclerosis. Here is a cross-section of 2 coronary arteries. The one on the left is how a normal artery looks like. The wall is smooth without any plaque. The one on the right is what a plaque looks like in the wall of the artery. The plaque is slow and intermittently growing. It may take 5-10 years or more to reach this size. It is silent because there are no symptoms until the obstruction reaches around 70%. At that point, one may experience chest pain with physical exertion, commonly referred to as angina, or until the plaque ruptures, causing a heart attack. Tragically, about 20% of those having a heart attack will suffer sudden cardiac death before reaching the hospital, leaving them with no second chance at life. Another 12% will die during hospitalization. These are not just statistics. They represent real people, real lives lost to a preventable disease. You probably think that arteries that are more severely obstructed are more likely to cause a heart attack, a 70% versus a 50% obstruction. No, that is not true. Only 14% of heart attacks are caused by arteries with greater than 70% obstruction. 68% are in arteries with less than the 50% obstructions that cause no symptoms until the plaque ruptures and causes a heart attack. The fact that these plaques are silent until they cause a heart attack is a major challenge. It is like a ticking time bomb. Now, let's delve deeper into the urgency of our cause. More than 600,000 Americans suffer a first heart attack every year, even though it has been considered largely preventable for over 2 decades. To put this into perspective, that's like witnessing 5 jumbo jet loads of people succumbing to heart attacks every single day. It's a staggering statistic that demands our attention. The total economic burden of cardiovascular disease, with heart attacks being a major component, is an astounding $1 billion a day. If we continue down this path without taking action, the projection is that this economic burden will reach $1 trillion a year by 2035. We cannot allow this to happen. This slide presents a graphic overview of the problem that we all want solved. I mentioned a virtual holding camp. I am referring to the millions of Americans with silent, undiagnosed, untreated coronary plaques. It is a virtual, not a physical place, where no one wants to be in, but unknowingly, they are in it. There are 2 exits. One is the heart attack faucet. No one wants that, but sadly, that is what happens to more than 600,000 Americans every year. A good analogy on this is an open faucet providing a continuous flow of heart attack patients that keeps cardiologists and a large cardiovascular disease care industry busy. Every cardiology specialist is helping mop the floor, diagnosing and treating heart attacks and its consequences. Each one has a specific role. If stent is needed, there is the interventional cardiologist. If a defibrillator is needed, there is the electrophysiologist. For heart failure, there is the heart failure specialist. If heart bypass or even heart transplant is needed, there is the heart surgeon. Let me share with you a life-changing story about Otto Boss, as told by his son Daniel.
His key aide is Otto Boss, an energetic press liaison in his mid-40s.
He was somebody important. I do remember that. Everybody knew him, and he was the guy behind the guy. So if you wanted to talk to Pete, everybody knew basically you had to go through Otto. So It was pretty cool. So everybody knew me as Otto's kid, and of course I was his firstborn, so everybody treated me like a rock star. So trust me, it was a great life, and everybody's kind of like, oh, that's Otto's kid. Be nice to him. June 2nd was, oh gosh, it was like yesterday. We were actually playing baseball out here on the front street. And my mother was inside here with our neighbor, and I was called in by our neighbor to, hey, can you please come in and talk to your mom? And I was a 15-year-old kid, so I'm like, yeah, lady, I'll come in when I want to come in. And then she came back out and she was like, no, seriously, you need to come talk to your mother now. She was sitting on the corner of the bed, and she basically just said that my dad had a heart attack and he was at the hospital. I was thinking, okay, he had a heart attack, he'll be fine. Because basically, in my eyes, my dad was like Superman, and nothing ever could really, do anything to him. We went to that hospital, and then when we got there, a doctor pulled my mother aside, and they kept going in and out, in and out, in and out. And then my mom came out, and she was very, very tearful. I knew something was really bad, because I kept going, when are we going to see my dad? And then, long story short, the doctor sat down in front of me about where you are, and just told me that my father had passed, and this is what had happened, and I was a little confused, one, why he was telling me, and not my mother. But they say his arteries were clogged. He looked young. He would never guess that he was 47. He had a rockin' tan, because he was always playing soccer. There was no indication that he was going to have the type of heart failure that he had. I don't know if it's good, but I grew up fairly quickly. So I'm 15 years old, I turned 16, I'm basically an adult. I'm no longer the kid that goes out with his friends and goes and parties and drinks and does, I don't do any of that stuff. And I mean, I had to be a role model for my younger brother and sister and not get myself in trouble and try to be dad for them and, coach Little League, which I did, and take my sister to ballet and my brother to basketball and do all the stuff that a dad would do. A lot of my friends like to hang out, but I really don't, just because my head's not there. I spent more time here making sure she was good and my brother and sister were good. And so that was basically my life for, oh gosh, until my mid-20s.
Otto's story serves as a stark reminder that heart attacks can happen to any older adult, even those who seem healthy on the outside. Otto and Margaret are victims, like many hundreds of thousands of Americans who died suddenly of a heart attack, whose voices cannot be heard. Let us give them a voice. In 2015, Dr. Kim Williams, then the president of the American College of Cardiology, said, "It is time to turn off the faucet instead of just mopping the floor." That really best describes our approach to heart attacks. Just keep mopping the floor and keeping the faucet running. The other exit is the early plaque detection exit via calcium scoring test. Access to calcium scoring also means access to optimal medical therapy that stops a heart attack before it happens. Unfortunately, access to this exit is blocked with dire consequences. Insurance executives, including Medicare, continue to deny access to calcium scoring test for the older adult Americans who need it. Even after the American Heart Association and American College of Cardiology approved and strongly recommended the test in October 2012, that's 11 years ago. This action created a wide disparity of care between two high-risk groups, causing opposite results. Group A paid out of pocket for calcium scoring and the insurance covered for optimal medical therapy with good to excellent outcomes. Group B has no calcium scoring and therefore received no optimal medical therapy with uniformly poor outcomes. Most of the people riding those planes are in Group B. This is to the insurance executives, including the Director of Medicare, Ms. Chiquita Brooks-LaSure. This is my best estimate of the human toll and economic cost of first heart attack from 2012 to 2023, after calcium scoring was recommended by the American Heart Association and the American College of Cardiology. How many lives and economic costs could have been saved if access to calcium scoring is not blocked? I think at the minimum, at least 50%. What is your estimate? This slide explains clearly why knowing that you have coronary plaques and getting optimal medical therapy is potentially life-saving. I want you to have an idea of what plaque stabilizing, plaque regressing medical therapy can actually do for those found to have high calcium score. This is a coronary CT angiography. Severe narrowing before treatment, well over 70%. After 1 year of treatment, it is significantly better. Moderate. After 4 years, the obstruction is just mild. Having access to calcium scoring and the medical treatment that follows can easily become a matter of life and death.
911, my husband's having a heart attack. We're going to start CPR on him, okay? I'm going to tell you what to do. Okay. 16, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, no, 7, 8, 10, 11, 12, 13, 14, 15, 16.
Our voice is also the voice of the voiceless, the many hundreds of thousands who died suddenly without even knowing what happened to them. I want to present an argument to the insurance executives why they should stop blocking access to calcium scoring, which I honestly believe the policyholders already paid for. I know that the best way to increase profitability is for insurance executives to find ways to increase premium while also finding creative ways to deny care that is already paid for. This is a widely practiced strategy and sadly, it works. But this is carrying it to the extreme. The 3 most common causes of death are heart disease, of which heart attack is the most common, followed by cancer and third, stroke. When a person starts having a heart attack, there is 1 in 4 chances that that person will just drop dead on the same day. That does not happen with breast cancer or colon cancer. The sum of our collective and constantly rising insurance premiums cover a $60,000 to $100,000 hospitalization for a heart attack, covers $3,000 for colonoscopy, $500 for mammography. If the premium covers for those, then it is enough to cover the $100 calcium scoring test that could have prevented that huge hospital bill in the first place. There is nothing controversial about calcium scoring test. Astronauts and presidents have been getting this test routinely as part of their initial physical for over 20 years now. What makes this important challenge even more challenging is we are not just fighting against heart disease but also against an old health system that favors and rewards mopping the floor, while also discouraging cardiologists from becoming preventive. In closing, let us join hands and hearts to bring about a new era in heart attack prevention. The Save Your Heart campaign is a call to action, a plea to turn the tide against heart disease, and a reminder that each life we save is a victory for all of us, especially after the pandemic that killed so many. Together, let's make calcium scoring a standard of care, a beacon of hope, and a testament to our commitment to saving hearts and changing lives. Thank you for watching and being a part of this remarkable journey. Let us march forward, armed with knowledge, compassion, and the power to rewrite the story of heart disease in America.